Hello, it's Dmitry again, and this will be hopefully the last Blueprints Psychiatry chapter that I'm going to be doing today for videos. I might do the earlier chapters later on. It's up for debate because I've read them already, so it's not like a big deal for me. But nevertheless, we're going to cover chapter 17 today, Psychological Theory and Psychotherapy. Again, this is the 5th edition of the Blueprints Psychiatry textbook. There is a sixth edition out there as well, which is updated in terms of content, and there's some differences in organizations, so just bear that in mind if you're using a newer edition, which I think would be recommended in terms of everything else being equal. So with that out of the way, let's get right into it. Chapter 17, Psychological Theory and Psychotherapy. There are a large number of competing theories influencing contemporary psychotherapeutic thinking. Psychotherapies derived from psychoanalytic, cognitive, and behavioral theories are the most widely used. Short-term psychodynamic therapy, cognitive behavioral interventions, and interpersonal therapy have the largest empirical verification. Little empirical evidence supports the efficacy of analytic dynamic therapies. Psychological theories. Psychoanalytic/psychodynamic theory. The principal theorist responsible for launching psychoanalysis as a technique and psychodynamic theory in general is Sigmund Freud. Freud's theories propose that unconscious motivations and early developmental influences were essential to understanding behavior. Freud's original theories have proved quite controversial and have led to the creation of various alternative or derivative theories subsumed by the three major schools of psychodynamic thinking. A better way to phrase that is a lot of the specifics of his theories are kind of like conjecture and don't really hold up to scrutiny very well. However, some of the very basic premises that he popularized, which debatably are not necessarily even from him in terms of its origin, technically, if you want to be really technical about it. But whatever, it's not a big deal. Regardless, some of the general ideas that they say, well, there's unconscious motivations that drive people. Sure, right. So if you want to be very, very, very general about what his theories are and kind of just ignore all the specific ideas that he came up with, then he has a lot of value to his... If you just ignore all the specifics, he seems pretty reasonable, So anyway. 20th century schools of psychodynamic psychology. There are three 20th century psychodynamic schools: drive psychology, ego psychology, and object relations theory. Drive psychology. Drive psychology posits that infants have sexual and other drives. This theory proposes that sexual and aggressive instincts are present in each individual and that each individual passes sequentially through psychosexual developmental stages. Again, this is from Freud originally. Oral, anal, phallic, latency, and genital. Included in drive psychology is conflict theory, which proposes to explain how character and personality development are influenced by the interaction of drives with the conscience and reality. I like how we don't even just talk about why there's issues with that, like no, infants do not have a sex drive. Like that's not, it's like we're not even going to look into it. Like, is this empirically validated? Not really. Or for that matter, the more absurd qualities to it, the idea that men have like a drive to want to have relations with their mother sexually, and they're at odds with their father because of that, or something like that. And women actually have a penis envy, and they want to have sex with their mother, but they can't because they have no phallus, and therefore now they want to have sex with their father because he has a phallus, and then they want to have sex with people who are not their father, who are men. And that's where female heterosexuality comes from. It's like that seems like not correct. Are there women who might have a phallus envy? Probably, but I think it's nothing. That's probably more of like being kind of a pervert than anything else. Same thing with a guy who's this is the whole thing with some sort of feminist Freudian thought where they say, there's men who have womb envy. It's like, there's probably a guy who has womb envy. It's like the average guy probably no. So they develop these sorts of very weird theories about how human beings develop their kind of behavioral tendencies. Why are men heterosexual? Why do men want to have relationships with women? Why do women want relationships with men, etc.? and they have these very weird, almost like pervert alert kind of situation where it's like, yeah, I don't think that's how reality works. And they just kind of present it like, oh yeah, here's drive psychology. It's like, well, I'm not so sure about how accurate that is. When I mean not so sure, I mean it's not correct. It's an inaccurate presentation of human drive. People have human drives. They have biological instincts. It just isn't that babies want to have sex. That's not what's going on. Sorry. That's very, very weird. And that's also just not accurate. So, ego psychology. Freud eventually developed a tripartite theory of the mind in which the psychic structure was composed of the id, ego, and superego. Under this theory, the id is the compartment of the mind containing the drives and instincts. The superego contains the sense of right and wrong, largely derived from parental and societal morality. The ego is responsible for the adaptation to the environment for the resolution of conflict. A major function of the ego is the reduction of anxiety. Ego defenses are proposed as which is in table 17.1, are proposed as psychic mechanisms that protect the ego from anxiety. Some ego mechanisms, sublimation, are more functional for the individual than others. That is to say, for example, denial. Now, this is another thing too. This tripartite model, I think, is originally from the Greeks. Again, we're saying, oh, Freud was this innovator. He came up with the id, ego, and superego. Again, this is probably not originally from him. Maybe the terminology is. Maybe his particular conception of it might be. I'm not going to deny that necessarily. But again, this is something that doesn't necessarily come from him per se. The idea that, oh, well, men have an id. What is id? The passions. People have a passion to want to sleep and eat and have fun and have sexual relations and so forth. People know that already. He didn't come up with that as an idea. And people have this concept of he says super ego, but the concept of some sort of superseding moral or ethical considerations that are afoot, like this is right, this is wrong, this is good, this is evil, this is ethical, this is unethical. And that's informed, of course, by morality, by, let's say, religion, by society, by your upbringing, what you think is right and wrong. And so when you have a situation, for example, where you have to make a decision, you're going to be influenced by both your own passions, right, what you desire on a animalistic, visceral level, and what you think is right and wrong. And so the ideal situation is, in theory, is that they're completely confluent. That is to say, what society says is right is also what your passions are driving you to do, and so there's no issue, and so you can just go do that thing, and there's no problem. The situation becomes problematic when you have your passions and your moral system disagree. Let's say, for example, you're married and you have a wife, but then you also have the secretary, which is kind of attractive. Your passions might say you should go and hit on your secretary. That's your id, theoretically. What Freud would call the id is this sort of passion, your animalistic passion, saying, oh, you should hit on your secretary and have sex with her and have an affair. Your superego, which is what we would call like sort of this intellect of the person, this sort of non-animalistic, sort of more of a concern that goes beyond the temporal. This sort of the desire for a sort of virtue or something like that. Your superego, your sense of morality would say, well, you probably shouldn't cheat on your wife. You shouldn't have an affair, that kind of thing. And so there's sort of this conflict exists between the passions and the intellect, between your moral system and this sort of animalistic id that exists, that your ego, which he says, which is kind of like which is basically your sense of your ability to make a decision, right? You as a person, what are you going to choose? Are you going to go choose to have an affair and you're going to give into this sort of animalistic passion, which he calls the id for Freud? Or are you going to go and say, I'm going to go refrain from doing anything like that. I'm going to be pious and chaste and this kind of thing. And you're going to be, give into what we would call the superego in the case of Freud. You're going to sort of acknowledge the moral right and wrong and do the right thing. So that's the idea for Freudian psychology between the superego, which is sort of the virtue or morality kind of consideration, the ego, which is kind of like your decision making, and then the id, which is sort of these sort of animalistic passions which don't necessarily care about the moral concern. What about object relations theory? And that theory is not totally, I would say it's not totally an incorrect way. It's one way of looking at things. It's a model for understanding how human psychology works. I'm not going to say it necessarily reflects on how the human brain works or how we should conceive of how a human soul would work from a theological, philosophical perspective, but certainly from a perspective of a model for psychology, it works, right? Right. I mean, you could probably conceive that there might be some issues with Freud's conception of that versus, maybe some sort of philosophical conception of what a human mind is or what a human soul is, or maybe how you conceive of and how a neuroscientist would necessarily view a human brain. There might be some issues how they would frame it, and how maybe there's some issues, some addendums, some ameliorations, some improvements, whatever, or maybe it would be more radical or whatever. But that's a model that works in many cases. Object relations theory. Object relations theory, objects refer to the important people in one's life, departs from drive theory in that the relationship to an object is motivated by the primacy of the relationship rather than the object being a means of satisfying a drive. Child observation furthered object relations theory, emphasizing concepts of attachment and separation. Table 17.1, common ego defense mechanisms. And by the way, with drive theory, I'm not sure drive theory today maintains the idea of the Oedipus complex. I'm sure it probably doesn't. But the Oedipus complex is where the son wants to have sex with his mother. That is a thing that Freud presented, that all the children that are male, the sons, subconsciously want to have sex with their mother, which I would contend, if that was true for him, I can't tell. I'm not here to judge, but I don't think that's true for most men. I'm going to tell you that. I'm going to tell you, from speaking from experience, I don't think that's true for most men. So, Table 17.1, common ego defense mechanisms. So, I don't know if drive theory maintains that today. I would suspect not. Table 17.1, common ego defense mechanisms. So, these are the ego defense mechanisms. So, we have denial. Feelings or ideas that are distressing to the ego are blocked by refusing to recognize evidence for their existence. Projection. Feelings or ideas that are distressing to the ego are attributed to others. Regression. Feelings of ideas or ideas that are distressing to the ego are reduced by behavioral return to an earlier developmental phase. Repression. Feelings or ideas that are distressing to the ego are relegated to the unconscious. Reaction formation. Feelings or ideas that are distressing to the ego are converted into their opposites. Displacement. Feelings or ideas that are distressing to the ego are redirected to a substitute that evoke a less intense emotional response. Rationalization. Feelings or ideas that are distressing to the ego are dealt with by creating an acceptable alternative explanation. Suppression. Feelings or ideas that are distressing to an ego are not dealt with, but they remain components of conscious awareness. So suppression is like you're aware of it, but you're not going to do anything about it. It's in the back of your head. Sublimation. Feelings or ideas that are distressing to the ego are converted to those that are more acceptable. Now, we also went over a similar list of things that are defense mechanisms in the psychiatry section of the first aid to the Step 1 textbook for USMLE Step 1 First Aid textbook. There's a psychiatry chapter that I read over that has I would say almost a more expansive section or list of these ego defense mechanisms. So you can go look at that video or just look at that textbook to find out more about that, or you can look it up online if you want to as well. Developmental theory. Erik Erikson made major contributions to the concept of ego development. Erikson theorized that ego development persists throughout one's life and conceptualized in psychosocial events drive change, leading to a developmental crisis. According to Erikson's model, individuals pass through a series of life cycle changes. Table 17.2, and we'll get into that. Each stage presents core conflicts produced by the interaction of the developmental possibility with the external world. Individual progress and associated ego development occur with successful resolution of the developmental crisis inherent in each stage. This model allows for continued ego development until death. Cognitive theory. Cognitive theory recognizes the importance of the subjective experience of oneself, others, and the world. It posits that irrational beliefs and thoughts about oneself, the world, and one's future can lead to psychopathology. In cognitive theory, thoughts of of cognitions regarding an experience determine the emotions that are evoked by the experience. For example, the perception of danger in a situation naturally leads to anxiety. When danger is truly present, anxiety can be adaptive, leading to hypervigilance and self-protection. When the situation is only perceived as dangerous, such as in fear of public speaking, the resulting anxiety can be psychologically paralyzing, and therefore also, by the way, disorderly, maladaptive. A person may fear public speaking because of an irrational fear that something disastrous will occur in public. A principal type of irrational belief is a cognitive distortion. Again, that's going to be in Table 17.3 in that situation. Behavioral theory. Behavioral theory posits that behaviors are fashioned through various forms of learning, including modeling, classical conditioning, and operant conditioning. Table 17.4. A behaviorist might propose that through operant conditioning, depression is caused by a lack of positive reinforcement, as may occur after the death of a spouse, resulting in a general lack of interest in behaviors that were once pleasurable or reinforced. Behavior includes observable actions, not mental states, and can thus be directly observed and measured. Behavior therapy may be used for agoraphobia, alcohol dependence, eating disorders, phobias, paraphilias, psychotic conditions, and sexual dysfunction. Table 17.5 lists common behavioral therapy techniques. Well, let's talk about psychotherapies. Short-term psychodynamic psychotherapy. Short-term psychodynamic psychotherapy is a modern manual-based systematic therapy that employs psychodynamic principles to treat psychiatric conditions. The therapy is usually less than 40 sessions and has a focus on the present, that is to say, early childhood and past events are not the focus. Conflicts and themes are the target of treatment and may encompass patterns of behavior or feeling. Recurrent themes in one's life and attention to wishes, dreams, and fantasies. Short-term psychodynamic psychotherapy, when properly applied by well-trained therapists, is broadly effective for improving quality of social function. Identified target symptoms and general psychiatric symptoms effects persist well beyond the treatment period. Short-term psychodynamic therapy appears to be generally comparable to cognitive behavioral therapy, or CBT, and interpersonal psychotherapy, ITP. Information to follow in efficacy, but individual patients may well show a superior response to one form of therapy over another. So let's see if there's a continuation section. No, it's IPT. So let's talk about these tables now. We were talking about a couple of those tables before, so let's talk about table 17.2, Erikson's life cycle stages. So again, he was talking about I think Erikson's stuff was talking about developmental theory. So we're talking about this right now. Developmental theory, Erikson's life cycle stages. So first stage between birth to 18 months is trust versus mistrust. The infant has many needs but does not have the power to have those needs met. The child is dependent on caretakers. If caretaking is appropriate, a sense of trust and hope is created. If inappropriate or inadequate, mistrust develops. Next stage is between 18 months and 3 years. That's the autonomy versus shame. The child is learning about the use of language and control of bowel and bladder function in walking. As a result, he or she begins to choose to explore the world. If caretaking is appropriate, the child will develop a healthy balance between exerting his or her autonomy and feeling shame over the consequence of exerting autonomy. Initiative versus guilt, which is going to be between 3 years and 5 years. As the child develops increasing control of language and walking, he or she has increased initiative to explore the world. The potential for action carries with it the risk of guilt at indulging forbidden wishes. Industry versus inferiority. 5 years to 13 years is when you see this pop up. The child begins to develop a sense of self based on things he or she creates. Caretaker influences are important in helping the child develop a sense of mastery and competence over creating. Identity versus confusion. 13 to 31. That's a pretty broad category. Corresponds to adolescence. How one appears to others is important in this stage. There are conflicts between one's identity and one's need to gain acceptance. 21 to 40, so again there's some overlap here. Intimacy versus isolation. The anxiety and vulnerability produced by intimacy are balanced against the loneliness produced by isolation. Generativity versus stagnation is between 40 and 60. If successful, the individual develops a positive view of his or her role in life and a sense of commitment to society at large. If unsuccessful, individuals move through life without concern for the greater welfare. Ego integrity versus despair. This is between 60 and beyond until death. An individual accepts his or her life course as appropriate and necessary. If this fails, the individual may regret or wish to relive some part of life, leading to despair. Now, here's the thing. This is a pretty general category, and so you could say, for example, there's really no reason why somebody, for example, wouldn't have to wonder about intimacy, for example, when they're like 18 or something like that. 21 is not like a magical number, right? Identity versus confusion, it could be different ages, right? These things are not necessarily set in stone. And the idea is that if you have a problem with one of these things during your life, let's say, for example, you start dating and you just have no success and you never find a significant other, you might have this sort of psychological hang-up where you just kind of have a problem and you kind of never really get over it necessarily. It just becomes a perpetual issue with you, where maybe you get over it in a certain sense, but it clearly has had a psychological impact on your life if you really never were successful in getting any sort of relationship. Same thing is true for if you have identity issues. Let's say, for example, you're let's say a second generation immigrant in a country, and you think to yourself, am I part of this culture that my parents are part of, or am I part of this culture that I'm growing up in, or maybe you're mixed race and you say, am I this race or am I that race, or your parents are different religions. And so you can think of all sorts of situations. Even if you were from one place and you grew up in one place and you moved to a different city, and now you're having this sort of culture shock. Like, this is all part of sort of that situation of like, who am I as a person? Who do I belong to? What community am I part of? That kind of thing. That's all part of that. And maybe you never really come to a conclusion on that. Maybe you always have this sort of tension between who you are as a person. Maybe you always have this issue where you never really find intimacy, or whatever relationships you have is not necessarily meaningful, fulfilling. Or maybe you had this situation when you're 40 to 60 where you feel like your life, you never really got off the ground, that you always feel like you're not doing enough and you never were successful the way that you wanted to be successful, right? Or maybe you had a situation with ego integrity versus despair, where you feel like you didn't do what you wanted to do in life and you never really got over that until you died, right? All these things can happen. So it's not necessarily that you always resolve the situation properly. That's kind of the opposite. Maybe you don't resolve the situation that causes psychological problems for you. Who knows? So it's something to be aware of. Table 17.3, types of cognitive distortions. Arbitrary interference, drawing a specific conclusion about sufficient evidence. Dichotomous thinking. So these are talking about, this is like related to cognitive theory, about cognitive distortions that are kind of warping your understanding of how things work and creating a lot of problems for you personally, like sort of these maladaptive tendencies. So arbitrary interference, drawing a specific conclusion without sufficient evidence, so you just have a warped understanding of what's going on. Dichotomous thinking, a tendency to categorize experience as a all or none. It's all good or it's all bad, it's all there or it's all not, it's one way or the other, instead of being sort of this gray zone that you have to go navigate further to figure out what's fruitful or not. Overgeneralization, forming and applying a general conclusion based on an isolated event. Right, so it's pretty self-explanatory. Magnification / minimization, over or under evaluating the significance of a particular event. So, that's all fine. So those are ways that you can kind of distort your understanding of how things work and your reality around you, and which can create maladaptive tendencies. Table 17.4, important concepts in behavior theory. So modeling, a form of learning based on observing others and imitating their actions and responses. Classical conditioning, a form of learning in which a neutral stimulus is repetitively paired with a natural stimulus, with the result that the previously neutral stimulus alone becomes capable of eliciting the same response as the natural stimulus. The example would be like, let's say, for example, I ring a bell and I give a dog food. And the dog likes the food and it salivates when it eats the food, when it sees the food. But if I ring the bell, if I do that enough and I associate with ringing the bell, eventually when I ring the bell, the dog's going to salivate and be excited for food, even if I don't have the food available for it. That's called classical conditioning. Operant conditioning, a form of learning in which the environment events contingencies influence the acquisition of new behaviors or the extinction of existing behaviors. That is to say, you can cause an animal to, or a person to start doing something new because you're rewarding them or you're punishing them. Let's say, for example, this kid gets a 100 on his math test and his parents take him out to his favorite restaurant. That's an example of a positive reward. And as a consequence, let's say, for example, he knows that's going to happen, so he does the same. He gets a 100% on the next math test because he studies so hard for it. That's an example of positive reward in a operant conditioning situation. The opposite being, let's say, for example, you have positive punishment, positive reward, negative punishment, negative reward. I'm not going to get into it. If you want to look more into it, you can look it up yourself. It's neither here nor there. But to be fair, you should know about it. IPT. The interpersonal school arose, so I guess that's interpersonal theory. The interpersonal school arose as an outgrowth of the object relations theory. The interpersonal theorists emphasize that intrapsychic conflicts are less important than one's relationship to oneself or sense of self and to others. In other words, the relationships in a person's life are given primary importance in producing happiness or misery. Interpersonal theory for depression and related conditions has a good empirical validation and may work as well as medication treatment and possibly better than CBT when interpersonal themes are prominent. So interpersonal theory could be, they say, potentially better than CBT. I don't know, CBT is pretty well regarded, but let's see. Let's talk about common behavioral therapy techniques. Just back into common behavioral therapy. So let's talk about that. Oh, let's talk about is IPT continue? No, it talks about CBT after this. So let's talk about common behavioral therapy techniques. So systematic desensitization. Patient approaches an anxiety-provoking stimulus after entering a relaxed state, often in a graded fashion. So this is like, you have, let's say, arachnophobia, so they kind of like show you a picture of a spider until you kind of get used to it, and then eventually you just see a spider in like a tarantula or something like that in a box, and you just have to look at it. And then maybe they have you touch it at some point, right? They kind of slowly get you accustomed to the idea. That's called systematic desensitization. Therapeutic graded exposure. The patient approaches anxiety-provoking stimulus in a graded... Therapeutic graded exposure. Patient approaches anxiety-provoking stimulus in a graded fashion, but does not enter a relaxed state prior to stimulus exposure. So the difference between systematic desensitization and therapeutic graded exposure is that for systematic desensitization, we're actually trying to get the patient is going to be calm before starting off. And so the system is involving you being relaxed initially. For therapeutic graded exposure, you're not being relaxed initially. You're actually not, we're not going through the relaxation process necessarily. We don't start you off relaxed and then get you into it. We just go into it. That's for therapeutic graded. We don't care if you're relaxed before. Flooding. Flooding, a patient approaches or is exposed to an anxiety-provoking stimulus without using a graded approach. So that flooding would be like let's say you're afraid of spiders. So we just throw you into a pit of tarantulas just to see what happens. That's called flooding. Participant modeling. Participant modeling. Patient view others and imitate behaviors of others. For example, watching another person approach an anxiety-provoking stimulus. So this is like seeing another guy hold a spider or whatever. That's called participant modeling, and say, oh, can you do it too? You're watching somebody else do the behavior so you can get accustomed to it. Assertive training. Patient is trained to monitor and modify responses to circumstances requiring acting in patient's best interests. Positive reinforcement. Patients are provided a rewarding stimulus after engaging in a specific behavior. So again, that's like the math test, you get a dinner afterwards situation. That's positive reinforcement. Social skills, there's other kinds of things like positive punishment, negative reinforcement, whatever. But anyway, social skills training. Patients lacking social skills in the specific dimensions systematically monitor and rehearse behavioral social skills. Okay, so this is sort of like a sort of practicing kind of situation for social skills. It's called, social skills training. Aversion therapy. Patients are provided nauseous stimuli, electric shocks, after engaging in a specific behavior. Now, with that, I'll give an example for you. That's like disulfiram. We were talking about that in an earlier chapter, actually in a video that I uploaded today. Disulfiram, let's say you take disulfiram, you drink alcohol, it's awful. It sucks. And it makes your brain associate alcohol with a bad outcome. So you eventually learn to not like alcohol anymore because it gives you these really nasty disulfiram reactions. So that's an example of an aversion therapy. In effect, using the same kind of mechanism. Let's talk about cognitive behavioral therapy, or CBT. So cognitive and behavioral theories form part of the basis of CBT. CBT involves an examination of the cognitive distortions and the use of behavioral techniques to treat common disorders such as major depression. CBT has strong empirical validation and is effective in the treatment of depression, social phobia, obsessive compulsive disorder, PTSD, and panic disorder. CBT and pharmacotherapy such as antidepressant medications are generally thought to be synergistic, particularly with regard to the treatment of depression. CBT as a treatment, however, appears to have long-lasting effects in terms of preventing relapse that have not been well demonstrated with medication treatment for most conditions. Dialectical behavioral therapy. Dialectical behavioral therapy, or DBT, is a psychotherapy developed specifically for the treatment of borderline personality disorder in females. The foundation of DBT resides in CBT principles, but the therapy encompasses empirical findings from multiple areas of psychology, sociology, Zen philosophy. Okay, so now we're doing some Zen Buddhism or something apparently, and dialectical philosophy. Overall, DBT focuses on therapist and patient acceptance of the patient as the foundation for developing skills for behavioral and emotional change. DBT has strong empirical support in the treatment of borderline personality disorder and is the first-line psychotherapy for treating this condition. Key points. Psychological theories are numerous, but those derived from psychoanalytic, cognitive, and behavioral theories are most widely used. The psychoanalytic school emphasizes unconscious motivations and early influences. The object relations school emphasizes the importance of relationships with other people. The cognitive school emphasizes subjective experience, beliefs, and thoughts. The behavioral school emphasizes the influence of learning. CBT and IPT have the greatest empirical support for treating depression and anxiety. Brief psychodynamic psychotherapy has empirical support for general efficacy across a range of psychiatric conditions. Okay, and that's really the end of our chapter. That was chapter 17, all about the sorts of, I want to make sure the title's correct. Psychological theory and psychotherapy. Okay, so if you got to the end of the chapter, hopefully you enjoyed it and hopefully it was useful to you. Regardless, in terms of the utility, you can read this chapter, you can read other kinds of textbooks that I've either read here, in the case of the psychiatry section, which is mentioned some of this material. Some of the stuff on here on the different kinds of therapies is a little bit more in depth, to be fair. But the I think the stuff about cognitive distortions, maybe more about the coping strategies. That's more, I think, in depth on the first aid textbook. So you can look at that video as well, or just look up the textbook online or something like that. Regardless, though, hopefully this was of use to you. Have a great rest of your day. Thank you, and goodbye.